Addiction is something that many people face every day, and methadone can help with those dealing with drug abuse. Renewed Beginnings is here to help. Mark Windley and Heather Bounds from Renewed Beginnings joins us to tell us how they help people on their path to recovery. Thank you both so much for coming on the show today. Some really great information that you're going to cover with us. And first, what is Renewed Beginnings for those who haven't heard of it before?
Well, first, Elle, thank you so much for having us on. Renewed Beginnings, we are a medication-assisted treatment center for people who may have different abuse, opioid abuse, addictions, and things like that. The center is, we feel we have a unique place in the things that we do and how we do it. We want to combine and take care of the whole total patient. People with addiction usually have some comorbid issues, mental health issues, and we want to address the whole part with the whole person and help them get back to where nobody wakes up in the morning and says, I want to be addicted to opioids or fentanyl or anything.
Right.
But we want to help them to get back to a place where they can be that person that they have dreamed to be. And so we do a lot of things as far on the medicated assistance side, and we want to connect people with the mental health side to help take care of that whole person.
Absolutely, a total and full recovery. That is certainly your goal.
Yeah.
And so kind of going back to the fentanyl and the heroin, why would someone get on methadone? Why is that a treatment that you guys use?
So and like Mark was saying, nobody wakes up and says that I just want, to be an addict today. I just want to start using. So what makes methadone different is when someone comes into our program, we evaluate every patient that comes in. We make sure that this is going to help benefit their lives. We don't just place anybody on it. They go through a full assessment, making sure that we have what it takes to help meet that patient's needs. Once they get on methadone, it really does three folds for them. It helps reduce withdrawal symptoms. If someone tries to use while on it, it blocks it out, so it can't work that way. And then it also just provides stability for the patient. So when they get on it, they're going to be monitored by the doctor. They also have counseling that's full encompass. So it's a full access treatment in that sense.
And so when they're on methadone, are they on it for a while? Can they be weaned off eventually? How does that kind of work? I'm sure it's very individual.
It is. It's entirely based on the person's needs. We do recommend once someone gets into treatment, you don't become addicted overnight, so you can't fix the problem overnight. It is a long-term treatment that is recommended. The longer someone's on it, the more chances they have to be stable. So really how long someone is on it is truly dependent between the patient and the doctor. That's between them.
Yeah, and so when you're in that recovery process, and you can also be on methadone, they kind of coincide each other, is that
correct? So think of it more, it's a medication to help take care of the withdrawal symptoms. Because when you're in recovery is not, you just wake up and you're in it today. It's a long-term thing that someone is in. So when someone's in recovery, they're actively, they're either attending counseling, meetings, whatever it is that they need to do to help to keep from going back to relapsing and using. So yeah, it's a long term in that sense.
Absolutely, and I'm sure there's other ways. If someone doesn't need that intense of a treatment plan, I'm sure there's other ways that you can treat the patient as well. So what are some of those ways, not nearly as intense?
Well, again, we try to take care of the total patient. We have counselors on staff. We have different ways. We have telehealth. If they need to talk to a different provider, we have ways to refer them to the areas or places that they need that can help them. We had a patient come in who wanted to get well. They did not have an ID. They did not have insurance. They didn't have transportation. We were able to help them get their Kentucky ID.
Wow.
Able to help them get set up on Medicaid. We were able to get them a bicycle, and now they're and they come every day and they don't miss, and they're so thankful for the help that they got. You have to help people get to a point where they're able to do what they know they can do.
Right.
And Renewed Beginnings, and that's why our name is Renewed Beginnings.
I was just gonna say, yeah.
We want to help people be in that place. and Heather has been doing this a long, long time. We have a great staff around us, people who really care about the people who are coming in the door. They get to know them and get to help them. A young lady has come in, and I mean, she has really worked so hard. She's getting into nursing school.
Wow.
So, yeah, I mean, it is so awesome to see the changes that are happening to people who got into a bad situation. Again, people don't intend to be like this, and we want to help that. I mean, opioid addiction in the community that we're in is very high.
Yeah, absolutely.
And we just can't leave people in that kind of way. And just helping people, you've got to have a passion and a heart for people. And at Renewed Beginnings, we do have that.
And seeing those success stories each and every day by all of your great work. So thank you so much for coming on today. Really great information. So again, to learn more, just go to renewedbc.com.